McGrath Foundation strives to provide free access to a breast care nurse regardless of location. So I know Katie does, we take calls and provide support outside of our organisations in which we're based, but we also try and direct everyone back to a breast care nurse in their local area if possible, because they know the specifics of the doctors that work in that area. So I quite often get calls from people that maybe are at Greenslopes Hospital and being at the PA, and I work and talk quite regularly with the breast care nurse. The Gold Coast is, I'll let Katie talk about that because it's a little bit of a different scenario.
So on the Gold Coast, we've just actually had three McGrath nurses appointed there, which is a new situation. And because it's not a regional hospital really, but because it's far away from Brisbane, there's a lot of private patients, unfortunately, who have support of a breast care nurse, but they work very part-time, for example. And we're just in the process of mapping that service to see how we can better support anyone who's not at Gold Coast as well. But McGrath are aiming to actually increase their numbers by 2025 to 250 nurses, and that will be inclusive of dedicated advanced breast nurses. Currently there's 32, so we're working towards that.
I know it's on the Gold Coast, it's something that Katie and I were advocating for I would say 5 years, for a dedicated metastatic role, as well as a role that was based in the community that would be able to work with anybody from any of the private hospitals more easily.